Assalamu alaikum. My name is Aida Noor and I'm from Department of BS Biotechnology, batch 17. Today the topic of my presentation is omega-3 fatty acids. Let us introduce omega-3 fatty acids. Omega-3 fatty acids are found in foods such as fish and flax seeds and in dietary supplements such as fish oil. The three main omega-3 fatty acids are alpha-linolenic acid, eicosapentaenoic acid and docosahexaenoic acid is found mainly in plant oil such as flaxseed, soybean and canola oils. Furthermore, the major two classes of polyunsaturated fatty acids are the omega-3 and omega-6 fatty acids. Like all fatty acids, polyunsaturated fatty acids consist of long chain of carbon atoms with a carboxyl group at one end of the chain and a methyl group at the other end. Polyunsaturated fatty acids are distinguished from the saturated and monounsaturated fatty acids by the presence of two or more double bonds between carbon and within fatty acid chains. Here is the chemistry of omega-3 fatty acids. Omega-3 fatty acids, one of the key building blocks of cell membrane, have been of particular interest to scientists for many of years. However, only a small group of the most important omega-3 polyunsaturated fatty acids are considered. Some monounsaturated omega-3s are pheromone precursors in insects. Polyunsaturates with a very long chain are commonly found in the central nervous system and mammalian testes in sponge organisms and are also immunomodulating agents. Numerous modifications of omega-3 acids are plant hormones. Basically, an omega-3 fatty acid is a fatty acid with multiple double bonds where the first double bond is between the third and fourth carbon atoms from the end of carbon atom chain. Short chain omega-3 fatty acids have a chain of 18 carbon atoms or less, while long chain omega-3 fatty acids have a chain of 20 or more. And here is the structure of most common omega-3 fatty acids. Let us discuss the manufacturing of omega-3. Many of the fatty acids can be synthesized by human, but there is a group of polyunsaturated fatty acids, the essential fatty acids that the human body cannot produce, omega-3 and 3 and omega-6 and 6 fatty acids. Omega-3 polyunsaturated fatty acids are being used quite extensively in the food industry to obtain omega-3 enriched food products. Basically, polyunsaturated fatty acids, especially omega-3, are essential in human nutrition science. They play an important role in the organism and prevent several diseases. Fish has been the traditional source to obtain omega-3 enriched oil and concentrates, although alternative sources as marine microorganisms or transgenic plants have been proposed recently. Here are some sources of omega-3. Food and dietary supplements. In food, both salmon, eggs, and chia seeds are excellent sources of omega-3 fatty acids. Salmon eggs, also known as roe, provide a concentrated dose of omega-3s, particularly EPA and DHA, which are essential for brain health and reducing inflammation in body. Chia seeds, on the other hand, contain alpha-linolenic acid, a plant-based omega-3 fatty acids that the body converts into EPA and DHA. Incorporating both into your diet can help support heart health, brain function, and overall well-being. Additionally, chia seeds are a good source of fiber, which aids in digestion and helps you feel full longer. And if I talk about the dietary supplements, LC omega 3s are present in several dietary supplements formulations, including fish oil, krill oil, cod liver oil, and products that contain algal oil. A typical fish oil supplement provides about 1000 mg fish oil containing 180 mg EPA and 120 mg DHA, but doses vary widely. Cod liver oil supplements provide vitamin. And if I talk about dietary supplements, LC omega 3s are present in several dietary supplements formulation, including fish oil, krill oil, cod liver oil, and vegetarian products that contain algal oil. A typical fish oil supplement provides about 1000 mg fish oil containing 180 mg EPA and 120 mg DHA, but doses vary widely. Cod liver oil supplements provide vitamin A and vitamin D in addition to LC omega 3s. Dietary supplements can contain several different forms of omega 3s, including natural triglycerides, free fatty acids, ethyl ester. Also, krill oil contains omega 3s primarily as phospholipids. Here are some uses of omega 3 fatty acids. Omega 3 fatty acids play several important roles in the body, including heart health, skin health, brain function, and immune function. Basically, omega 3 fatty acids are thought to help reduce the risk of heart diseases. They have been used along with diet and exercise to help lower the level of certain blood fat and to rise the level of good cholesterol. If I talk about the heart health, they can help reduce triglycerides, lower blood pressure, and decrease the risk of heart disease. And if I talk about skin health, omega 3s help maintain the integrity of skin barrier, keeping it hydrated and reducing inflammation. This can lead to healthier, more youthful looking skin. And if we talk about brain function, in brain function, omega 3s are crucial for brain development in infants and maintaining cognitive function in adults. They may help reduce the risk of age related cognitive decline and improve mood. Whereas in immune function, omega 3s may help support immune function by reducing inflammation and promoting the production of anti inflammatory molecules. Now let's talk about the deficiency of omega 3 fatty acids. A deficiency of essential fatty acids, either omega 3s or omega 6, can cause rough, scaly skin and dermatitis. Plasma and tissue concentration of DHA decrease when an omega 3 fatty acid deficiency is present. However, there are no known cut-off concentrations of DHA or EPA below which functional endpoints such as those for visual or neural functions for immune response are impaired. Deficiency of omega 3 fatty acids can lead to various health issues, including cognitive decline, mood swings, dry skin, and poor cardiovascular health. It's important to include sources of omega 3s like fish, flax seeds, and walnuts in your diet to maintain optimal health. Because without an adequate intake, individuals may experience cognitive issues such as memory problems and difficulty concentrating, as well as increased risk of heart disease and other inflammatory conditions. Here are some benefits of omega 3 fatty acids: omega 3s and ADHD, omega 3s and heart disease, omega 3s and asthma, omega 3s and anxiety, omega 3s and migraine headaches, omega 3s and cirrhosis. If I talk about omega 3s and ADHD, ADHD is a common condition faced by people of all the ages. A 2016 study demonstrated that omega 3 fatty acids could be beneficial in treating those with ADHD symptoms. Other studies have also shown benefits. If I talk about omega 3s and heart disease, omega 3 and heart disease kills millions of people worldwide. Modern medicine focuses on reducing risk factors such as high blood pressure, cholesterol, and diabetes in the hopes of reducing complications from heart disease. Omega 3 fatty acid may also play a role. And if I talk about omega 3s and asthma, worldwide 300 million people are affected while almost 250,000 people died from complications of the condition annually. Asthma can cause symptoms like wheezing, coughing, and shortness of breath. Researchers noted a decrease in these levels in children with mild to moderate asthma while taking 180 mg EPA, 120 mg DHA daily for 3 months. Additionally, clinical pulmonary function testing improved in 72% of patients. And if we talk about anxiety, anxiety disorder affects millions worldwide. In 2018, 11 countries concluded that omega 3 fatty acids could help reduce symptoms of clinical anxiety. Other studies have found similar findings. If we talk about omega 3s and migraine headaches, migraine headaches that can be altering. They are also leading cause of work absence. In 2017, the study showed that omega 3 fatty acids could be helpful in the treatment of those with migraine headaches, possibly by reducing inflammation in the brain. In omega 3 and cirrhosis, cirrhosis is a chronic inflammatory skin condition that generally presents with raised, dry patches of skin. It can be very difficult for those who are affected with cirrhosis. In addition to avoidance of foods that may trigger a flare up, such as dairy or wheat, omega 3 fatty acids have become a popular option for many. Also, if a person cannot eat yogurt and fishes, here are some alternatives of such foods like canola oil, chia seeds, flax seeds, soybean, walnuts. So, these are the references. Incorporating sources of omega 3s into your diet or thought supplementation can be beneficial for your well being. Thank you for your attention.